Hello, Dr. Vijay Garu. Thank you so much for taking your time and coming for this interview to answer most questions which people have usually about heart attack and heart diseases.
Correct.
Being one of the top cardiosurgeons in Visakhapatnam, we are very glad to have you here.
Thank you so much.
So let's start with the basic question. What is a heart attack?
So, heart attack is a condition which is, many people will know, it's a life-threatening condition. Like all the organs in the body, even heart will have its own blood supply. And when the blood supply to the heart has a sudden stop or sudden cessation, then the muscle will have a permanent damage. That is called as heart attack. So it can be in various severities. When it starts, it is called as angina or chest pain. That is a warning symptom. So typically people will give you the warning symptoms like pain in the central part of the chest, going to the left hand, left shoulder, left side of the face, neck, sometimes to the back. And it's a very unbearable pain. And people cannot mistake it for anything else. Generally, this kind of pain is something called as warning symptom. Once, if this is not treated, this is a reversible condition. If it is not treated, this will lead to a permanent damage where the blood supply cessation, if it lasts for more than 3 to 6 hours, heart muscle will suffer something called as permanent damage. Then it will lead to damage to the heart muscle. So that is called as heart attack.
Thank you for explaining it in very simple terms. So what are the risk factors of heart attack?
So coming to the causes or the risk factors which can cause any person to suffer a heart attack, in the present generation, the most common risk factors are a person being diabetic, a person who has some of the lifestyle habits which can cause him a predilection to have heart attack. Somebody who was having a very limited lifestyle in terms of being very, very less physically active, a sedentary lifestyle, what we call, somebody who has habits, especially cigarette or nicotine consumption in any form. It can be smoking, it can be chewing tobacco, it can be use of gudka, kaini, or in any form. These are the two main causes which increases the risk manyfold, almost by 10 to 20 times compared to a general population to cause heart attack. Apart from this, men in generally, because of their hormonal body habitus and because of their predilection to have these disease factors, they tend to have heart attacks more commonly. The familial and genetic issues, that is inherited gene pool which will cause abnormalities in body metabolic disorders to cause heart attack, is a very less common cause. So basically we are looking at a population who are having diabetes which is badly controlled, and a population which are having bad habits. It includes smoking, alcohol, and any kind of bad physical activity, reduced lifestyle. These are the people we are looking at as risk factors or causes of heart attack.
So how high is the risk of heart attack in young children compared to young adults or elderly people? So there are three phases: children, young adults, and elderly people. So is there a difference that children might have less heart attack and adults may have more? So on what basis do people generally get heart attack?
So heart attack, rightly so. Heart attack is a condition which is seen generally, which was seen in the age group of 40 years and above. Because by the time the blockages in the arteries develop, they have to have some risk factors, like I told you before. And it is very, very uncommon to see heart attacks in younger population. And children, it is very, very rare. Somebody who has familial or genetic problems where cholesterol is formed in a very, very high quantity in abnormal fashion, they can have heart attacks as early as 10 years, 12 years, or 13 years. But that constitutes about 1 to 2% of all the people who have heart attack. So the most common age group that heart attacks are seen is between 40 and 60 years. And as the age increases, every 5 to 10 years, risk of getting a heart attack increases by about 3 to 4%. In the present scenario, because of a lot of additional risk factors that is there, in the presence of very bad food habits, in the presence of use of nicotine, use of alcohol, and a very poor physical habitus, we are seeing occurrence of heart attack in younger people. Generally, if I say anybody who is having a heart attack less than 40 years, I would be alarmed, because it's not the right age group where a heart attack can occur. And these people generally are susceptible to having a very severe form of heart attack, very severe form of disease, and they generally do not do well with any form of treatment, be it medical or surgical. So generally heart attack, we restrict it to people who are elderly age group. Of late, you would have heard about COVID causing heart attack with the vaccinations also. COVID as a predilection has caused blockages in arteries in every part of the body. And so with the heart also. So people who have had COVID, they have an increased risk that they can have heart attack, especially if they're between 30 and 40 years of age. And there is a slight increase in incidence, what we have seen after the COVID has finished.
So, sir, what are the symptoms or signs of a heart attack?
So any patient who suffers or who's having a heart attack would typically complain of a very unbearable, heavy kind of pain in the chest. It will be usually in the central part of the chest or the left side of the chest. It can go to the left side of the jaw, neck. It can go to typically goes to the left shoulder and the left hand. This is because the heart and the left upper limb shares the same nerve innervation. So the pain radiates to the left side. Along with this, the patients can have something like excessive sweating, sudden weakness, and they may have sudden unconsciousness, depending on the severity of it. If the patient does not identify that, okay, this is something which is not a regular gastritis or a regular stomach problem like an acidity, the symptoms can rapidly progress into something which is a life-threatening condition when they can have sudden unconsciousness. They may have something called as rhythm disturbances because of the heart attack, and lead to death also. So it is important to identify these warning symptoms and take medical attention appropriately at the appropriate time.
So as you said, what can a person do if he's suspected of a heart attack, or some person beside him? What can he do? What can he do to be helpful?
So in the event that you're in the midst of a social gathering, or yourself or anybody else is having some kind of symptom where you suspect that this person fits into a group where he can have a heart attack, or he knows that the pain is very severe, or you can see that the person is visibly very, very uncomfortable and not at all feeling well, the first thing that you need to do is make him rest, sit down for about 2-3 minutes, calm him down. This will try to make his pain to be differentiated from any other condition that can have. If the pain is not subsiding, say even after about 3 to 5 minutes of time and after taking rest, the first thing that has to be done is, wherever he is, take him to the closest place of medical facility available to get an ECG done, and subsequently whatever first aid is required, that will be possibly done after the ECG is noted. The ECG is something which will pick up the heart attack in a very early stage, and once ECG changes are seen, then the treatment part or the investigation part can be expedited, because once a permanent damage occurs to the heart, unlike any muscle in the body, it cannot be recovered back. And the condition that from a heart attack to go through a life-threatening situation is very, very easy. So first thing, give him a couple of minutes of rest, and if it is not still subsiding, take him to the nearest medical facility available to get a simple ECG. It can be any clinic, nursing home, or a bigger hospital. Please do not choose that I need to reach to a bigger facility 10 kilometers in a distant facility. You need to go to the closest facility, because first aid will actually save many lives rather than going to a bigger 5-star facility.
That's a very actually good point. Usually people see a very better clinic and they're in this myth that bigger hospitals provide the best treatment. So that's a very good point, sir. Thank you. So what are the treatment options available for heart attack?
So once we receive somebody who is identified as going through angina, chest pain, and maybe having something like a heart attack, we do a series of tests. It will involve something called as an ECG. A blood test is done in the initial event, which is called as troponin levels. This is a very specific test for the heart itself to differentiate any other condition that can have the same kind of symptoms. So if these two are elevated, they will do a series of completion tests, which will include an echocardiogram, which will identify the function of the heart, and if there are any mechanical complications of it. Once the patient has been identified based on these tests that is suffering from a heart attack, he will definitely undergo something called as a coronary angiogram. Angiogram is something called as a test where a small wire is passed from the hand, most likely from the hand, and it will identify the heart vessels. Normally, there are 3 arteries in the heart. The guide wire will pass into the heart. The cardiologist will do a test with using a small contrast dye, which will be injected into the artery to identify the blocks. The identification of these blocks are important because we need to identify where the block is and what treatment has to be done subsequent. So once a person comes with a heart attack, these are the series of steps that will be taken. ECG, echogram, and then a blood test, and subsequently definitely a coronary angiogram. Once the angiogram is done and we have convincing evidence that yes, this is the cause of the heart attack, they can be put into something called as a treatment, which will be medical treatment, where the clots can be dissolved giving medications over a period of 6 hours, 12 hours, or 24 hours. If the blockage is something which is feasible that it has to be opened up in a major way, stenting can be done in the immediate setting. If the blocks are, say, in all the 3 vessels, or if it is more complicated, or if it's in location where stenting is not feasible, these patients will be treated and directed towards something called as a bypass surgery. So these are broadly the types of treatment options that will be there for any patient who is suffering from a heart attack.
As you have mentioned, stenting and bypass surgery as treatment options. Can you please give us a small brief of each of the treatments?
Okay. So stenting is something called a procedure where when the angiogram is done through the radial artery or sometimes through the thigh, a specialized device which is called as a metallic tube. Okay, it's something like coiled. When we have the refill springs, what we use, something similar to it. It is put into the artery, and the block in the artery is expanded over it. And these can be self-expandable or balloon expandable. So they will identify the block area and put something called as a stent, which opens up the block totally between the blockage and the normal portion of the artery. So this will instantaneously open up the blocks, and it will clear, it will start perfusing the blood muscles again. So what will happen is the damage of the heart attack is immediately stopped, and the flow of blood is immediately restarted in a stenting process.
Okay.
It in normally 1 or 2 stents is put in the setting of a acute heart attack. And these patients will be on lifelong medications to keep that stent opening, because it's an external device and the body should not reject it. In a patient who needs something called as a bypass surgery, what we generally do is we take something called as arteries or veins from the patient's body himself. So it involves taking something called as internal mammary artery. There are 2 in the chest. We can take artery from the hand, and we can take veins from the leg. And this is used to put additional ways of blood supply to the heart. So it is like in addition to the normal blood flow, there is another channel of blood. It's like adding another road to a block road, and that will give more blood supply to the blocked portion of the heart. So since these patients are, we are using in these patients own material. It's not like an external material which is made of special metals or something like that for a stent. They do not need, as severe lifelong medications as a stented patient. So the amount of requirement for medications are less. So generally, if a patient has 1 or 2 blocks, we prefer them to go for a stenting. If the blocks are more in number, and if the blocks are in very critical situation, then we need to look at somebody to advise for a bypass surgery.
So which is better, bypass or stent surgery? And which has long-term results and which has a lot of risk factors?
So when we compare the 2, it's like comparing something which is like an apple and an orange. So both the procedures have its own advantages and disadvantages. A stenting can be very ideal in a situation when there is blockages in one or 2 vessels, like I earlier explained. And these vessels will be open immediately. And if they maintain their medications lifelong, it generally lasts very well. In compared to that, when we operate and give the patient something with a bypass surgery, the result of it definitely outlasts the stenting procedure, because stent use something which is a foreign material, and there is an inherent tendency of the body to reject it. When we do a bypass surgery, generally when we use something called as arterial conduits, these patients usually have benefit more than 12 to 15 years of time. And most long-term studies have proven that bypass surgery, when there are blocks in all the 3 vessels, the results of it is much, much superior to a stenting procedure. Most of these options between stenting and a bypass surgery is usually decided based on each patient's condition. We cannot say that one patient, okay, or all the patients, we cannot say that stenting is superior and bypass is not superior, or bypass is superior and stenting is not good. So for each patient, depending on their condition, we usually advocate, okay, this is better for him and this is better for him. And then take a call what to do for it. In terms of risk factors, generally the feeling is that any patient who goes for a surgical procedure, and especially for the heart, they think that no, it's a very major surgery and they may or may not come out of it. It is a myth so far. With advancements in the current techniques and instrumentation, any patient who undergoes a bypass surgery also, be it open surgery or through keyhole, generally they go home by 4 or 5 days time and generally get back to their normalcy about 1 month's time.
So what are the surgical options for these issues?
So when we discuss about surgical options like a bypass surgery, we look at somebody who is getting operated conventionally, and time tested one is getting operated through the center. Usually we cut the chest cage and open the bone called sternum and bypass all the blocked vessels. There are options of using conduits from the arteries within the chest wall, hand or leg, like I explained to you. In the last probably about 2 years or 3 years, we have started something called as keyhole surgeries. Keyhole surgery is something which is done without cutting the bone. Generally, there is an incision for about 6 to 8 inches in the midline of the chest or doing a regular bypass surgery. Here we are doing something which is about 2 to 3 inches of incision. We use specialized equipment and instrumentation to reach the heart and do a bypass of the same way where it was done in the conventional way. The advantages of doing it through a keyhole is that it minimizes the pain that the patient has to go through because we are not cutting a bone. And it expedites the recovery of the patient because bone healing is much better. Because pain is less, they recover faster and they return to work as early as about 2 weeks or 3 weeks to actual hard physical labor. So that is the advantage of doing something which is a keyhole surgery. And since we have learned this phase of teaching and learning this process, we are in a place where we do it regularly and achieve very good results out of it.
So in this current generation, a lot of people, youngsters, go to gym, and have seen a lot of news where a lot of people die in gym due to cardiac arrest. So as a cardiosurgeon, as a doctor, why do you think this usually happens, and what is your take on this?
So in the last probably 6 months to 1 year, we have noted quite a good amount of physical injuries and famous personalities suffering cardiac arrest and unfortunately dying at a very, very young age. So being physically active and having physical routine are two different things. Physical activity means in a day you're doing a particular amount of steps, particular amount of chores, which are making your body to go through a rigorous exercise. Being physically active in a enclosure of a gym and doing exercises which are in terms of cardio exercises or cardio workout exercises, majority of them are on some kind of probably some amount of anabolic steroids. Some amount of them are unmonitored kind of cardiac exercises. And when you do these exercises in an intent to build up your core strength, that is different. But when you do these exercises in an intent to build up your body in a very rapid succession, what happens is your unmonitored exercise. So you're putting your body through the exercise routine, which is not in a healthy way. You're using some supplements which will be detrimental to the health of the heart and cause blocks in the heart. And you're doing the exercise over on top of it. So you're giving a condition where you're using drugs or medicines which will cause blockages, and you're actually making your heart work more. And that will cause something called as acute heart attack. And if you don't stop at it, what will happen is a sudden death. So majority of the people who have been in the news because of sudden cardiac arrest is probably because of this. There is unmonitored excessive physical work and in the uses of something like supplements, the amount of stress the heart goes through it is phenomenal. And when you don't identify it and you cannot give a first aid at that point of time, the damage that happens is very, very rapid and very, very extensive. And that is why they ended up in a life-threatening situation.
Thank you so much, sir, for taking your time and explaining all the factors, causes, treatments, and everything about heart attack in very simple terms so that all the viewers would understand. Thank you especially for taking your time and explaining it very briefly, not in a very complex term. So thank you so much.
My pleasure.